Good morning, everybody. In the last year, there has been much discussion about the death of Freddie Gray. And that's as it should be, because we need to face truths. We need to face hard truths if we're to bring about change. But in addition to the hard truths about Mr. Gray's death, there are in fact hard truths about Mr. Gray's life. And those hard truths are very relevant to this conference and to the panel that we'll have in a few moments. Because the roots of the circumstances and challenges of Mr. Gray's life and the lives of so many children and families in Baltimore and in cities across the country, those roots can be traced back to decades and decades of a kind of negative collective impact. Now, in conferences like these, we're used to exploring how collective impact can improve outcomes. And we often spend a lot of time dwelling on how hard it is to get people to work together, to get people to focus on a common goal, and to move forward on that goal. We may forget that we have actually seen collective efforts have extraordinarily negative effects throughout our history, too often in ways that either leave out many of our people or worse, deliberately restrict their opportunities and their odds for success. And one of the most powerful examples of that kind of negative collective impact is the definitely cross-sector, clearly deliberate practices, programs, and policies at the local, state, and federal level, as well as in the business community and in the nonprofit community, that had a simple and rather explicit goal, which was to segregate and to subjugate African Americans in this city. Our history is stark. Every sector of this city contributed to this negative goal. The public sector passed laws and enforced policies to limit where African American families could live. Private developers, real estate brokers agreed to covenants that restricted sales in certain neighborhoods to whites only. Neighborhood associations, nonprofit associations were formed with the purpose of enforcing these covenants. And we went from these practices and these customs that we had in the city of Baltimore and many other cities across the country, we went from these practices actually to policy, to state and federal policy. When federal programs were created in the 30s to provide low-cost, long-term mortgages to folks, redlining was also instituted. And redlining basically meant that the resources from the federal government for those low cost and long-term mortgages could only be used in certain neighborhoods. Red lines were drawn around undesirable neighborhoods, and those neighborhoods were defined as undesirable explicitly as those that had high proportions of African Americans. When veterans' benefits were expanded after World War II to include low interest, low down payment, federal guaranteed mortgages, those redlining policies were simply copied over into the veterans' benefits policies. And as a result, whole generations of black families lost out on the opportunity to build wealth and to build stability. Housing in black communities deteriorated, and poverty became ever more concentrated. It wasn't just housing policy. Transportation policy also contributed to the deterioration of these communities and these neighborhoods. Public transportation in Baltimore and other cities was designed to serve the needs and preferences of white neighborhoods. Highways not only accelerated white flight, but also promoted the relocation of businesses and jobs out of the city and into the surrounding areas. And they also obliterated whole swaths of stable African American communities in this city. Now, when Baltimore and other cities began to lose manufacturing and other jobs, we had a choice as a country. We could have invested heavily in education and skill development to ensure that all of our people were prepared for the new global and tech-heavy economy that was emerging. That's a choice we could have made. It's not the choice that we did make, however. Instead, we chose to treat those who needed our help and who needed a transition to this new economy. We chose to treat those people as a threat. And we moved instead to a policy of mass incarceration of adults and young people alike. So the hard truth is that Freddie Gray's hard life and his tragic death were emblematic of the impact of this negative collective impact, this negative collective efforts to segregate and to subjugate African Americans in Baltimore and other cities. And when you look at the life of Freddie Gray, you can see the result. Mr. Gray was born 2 months premature to a substance-abusing mother. He was reared in a segregated neighborhood of intense, concentrated poverty. He was exposed to lead paint and lived in dilapidated housing. He had accumulated a debilitating level of lead in his bloodstream at a very early age. He missed milestone after milestone after milestone, and he registered below proficiency in educational measures at every age. By the time he was 25, the year that he died, by the time he was 25, he was neither working, nor was he in school, nor did he have prospects to get a job or to return to education. And importantly, he was well known to law enforcement as a target of frequent arrests for minor drug offenses. Now, the point of this story is to lift up the power and the potential of collective impact to change lives for better or for worse. I believe it's simply a matter of public and political will. When we had the will, we acted collectively to limit opportunity and to put people on a path towards poverty. The question, I believe, before us is, do we have the will to act collectively to redress that sad and tragic history? I would argue that we can learn from that history and apply the lessons of that history to what we do. And fortunately, we have an increasing number of success stories where collective impact, collective work together has in fact led to better outcomes. In Baltimore, people from across multiple sectors, business, government, nonprofits, philanthropy, came together a number of years ago to focus on school readiness. We had terrible school readiness numbers. Young children would enter kindergarten with only 28% of them ready for kindergarten on basic tests. And over a 10-year period, we increased that number to 78% through collective impact. Similarly, we came together around healthy births in Baltimore and continue to work on that. The result, a decrease in infant mortality of 28% to the lowest rate ever recorded in the city. And we are now even more ambitious. Baltimore's Promise has been organized to help propel every child in Baltimore from cradle to a fulfilling career, and to draw on the contributions of every part of Baltimore as we move forward. As with other Strive Together sites, we are working on a data-driven long-term agenda to invest in what works to achieve our specific measurable results. Now, this kind of effort, the kind of effort that Be More for Healthy Babies and School Readiness and Baltimore Promise illustrate, this kind of effort requires us all to work in very new ways. It means we have to structure our work around results rather than structuring our work around existing funding streams. We have to organize ourselves around whole populations rather than around the silos that we usually organize ourselves. And we have to organize ourselves around evidence about what works rather than our deeply held opinions or preferences, which means we have to learn all sorts of new behaviors. One of the new ways we have to work is to find the collective will to include race and conversations about race and action on race as part of the collective impact movement. So all of our children are on a path to opportunity. Our panel today includes leaders who are showing us new ways to work together in government, city government, state government, and federal government, so they can work together on behalf of a better future. I'm going to introduce the panel and ask that they join me on the stage. We will be joined shortly by Mayor Stephanie Rawlings-Blake, and I will just now say that, so that she can just join us seamlessly, that Mayor Rawlings-Blake is, of course, Baltimore's mayor. Her commitment to Baltimore kids and families has been crucial to the progress the city has made on many fronts. Her administration has used outcomes-based budgeting, which has been instrumental in helping to make tough decisions to invest in what works. She has also convened a youth cabinet that creates opportunities for conversations and collective action among city agencies and external partners. She has been absolutely critical, and her work has been critical in drawing everyone's expertise to the most critical issues facing this city. Arlene Lee is the executive director of the Maryland's Children's Cabinet, where the governor convenes the secretaries of state agencies that touch the lives of children and families. This cabinet is one of the flagships in the Forum for Youth Investments Network, an initiative that we've been proud to support because we think this kind of collaborative work is so important. Please join us, Arlene. And Mary Ellen Wiggins is a senior analyst at the Federal Office of Management and Budget, where she serves on both the Community Solutions team and the Evidence team. Isn't it great that we have a federal government with an evidence team? I love that. OMB has led the federal charge on outcomes-focused, evidence-based strategies like the Performance Partnership Pilots that you're also familiar with for disconnected youth and the Promised Neighborhoods Initiative. Mary Ellen, please join us on stage. So welcome. I'm going to ask, beginning with you, Arlene, if you would just make some opening comments, and then we'll turn it to Mary Ellen, and then I've got a few questions.
Great. So I thought I'd talk a little bit about how the Children's Cabinet operates in Maryland using actually the Entering School Ready to Learn example, because I think it was a great success story, as you identified, and it operated on all levels. So I guess it was about 15 years ago when we started to think about the fact that we needed to be focused on a set of results with the help of the Casey Foundation and the Center for Study of Social Policy and a few other local friends. Maryland established 8 goals that for us said, if we can reach these goals, we'll know that children have the well-being that we're seeking for them. Starting with babies born healthy, children enter school ready to learn, children are academically successful, and all the way through to safe and thriving communities. We focused on children entering school ready to learn as the goal, and it was established as a goal for the Children's Cabinet. It was something that we identified for our local partners, and we also were being held accountable to that result by the Joint Committee on Children, Youth, and Families. So we had the executive branch working collectively on their particular contribution to that goal. We had the Joint Committee and actually our budget committees as well, asking the Children's Cabinet on an annual basis, reporting out, what have you done, who has been doing that work, what have you accomplished. And we were then also partnering with the local management boards in Baltimore, that's the Family League, where we have people working on the local level also in a collective way, across systems, across sectors, to be able to then contribute to the goal that they've identified. As a result of a number of different things that we were able to put into place, we saw significant improvement overall for the whole state, driven, I think, by the work here in Baltimore. They all came together. We had city leaders come together to really say, what can we be doing differently to ensure that children are healthy when they get to school, that they're able to recognize their colors and their numbers, that they have both cognitive and physical skills that are going to allow them to be successful, and what was everyone's contribution to the living circumstances, the family's conditions, the child's health, the child's ability to learn. And through that effort, we were able to see the kinds of numbers that you talked about, Patrick, but being supported by the state because the agencies were also focused on that same goal and looking at how they could contribute to the work that was going on at the local level. So for us, I think that was the perfect example of how we could align our both branches of government, the work on the local level around a particular goal, to be able to say this is something that we as a state are fully committed to, and we could see the results that came out of that collective effort.
Terrific. Thanks, Arlene. Mary Ellen?
Great. Well, good morning, everyone. Thank you so much. It's great to have the opportunity to be here. I know that this is a panel on aligning policy. I'm actually going to talk a little bit about aligning both policy and execution because those things do go so much hand in hand together. So to step back for just a moment and also to kind of harken back to some of your comments, Patrick, this administration from the beginning has been really cognizant of the fact that as of now, as most of us know through our experience and as has been validated through research, the zip code that a child grows up in does so much to determine that child's outcomes. And what we're trying to change is making zip code a determinant and a detractor, which is a terrible thing, so that all children, all youth, all families have access to the same opportunity. The way that we've really approached doing that is rethinking the outdated and very top-down, heavy approach the federal government has traditionally taken to working with state and local and tribal government partners, and really transforming the federal government into more of a proactive and productive collaborator. So we're really doing that in 3 different ways. The first way is just thinking about how we really work with communities on the ground. So instead of coming in with a very narrow-minded approach that thinks about one particular issue or one particular grant program and having a bunch of rules that require compliance, thinking about how we can really listen, understand the integrated goals or roadmaps that a certain community has to achieve specific outcomes, and understanding how we can be a partner in enabling and empowering that community to meet those goals. The second change is really rethinking how we actually work with one another. So many of you may have noticed that sometimes the federal government can be a little bit siloed. And if you are working on improving a very integrated goal in your community, so thinking, for example, about the intersection of poverty and housing and transportation, to touch on some things, Patrick, that you mentioned, you might traditionally have to go to 3 to 5 different federal agencies, tell your story multiple times, and then those agencies won't necessarily talk to each other and think collectively about how to help you out. So the change here is really having agencies know how to work together, think across silos, and speak with one voice as we work in partnership with local leaders or with local organizations. And then the third change is really thinking more about data and evidence and evaluation. And where we actually already know what works and can promote that, where we need to build further knowledge, and then where we need to build capacity so that people actually have the right tools to understand what's going on in their communities and really drive results. So what that looks like in practice is a number of different policy initiatives that may be familiar: promise zones, promise neighborhoods, tech hire, performance partnership pilots for disconnected youth. These are just some specific policy examples. Performance partnership pilots for disconnected youth, or P3, is one that might be particularly interesting because it does allow local communities or states or tribal governments to think about specific education, employment, or other outcomes that they're really trying to achieve for the population of youth who's not in school, not working, faces other challenges. Think across 7 different federal agencies, all the different resources that they offer, and how they could pull from all those different agencies and get customized flexibility so that they can use all those different funding streams in one pot with one set of rules and requirements around it, with accountability for really changing those education, employment, and other key outcomes. So it's a whole different lens on how we serve people, thinking, again, as you were saying, about the outcomes that we're trying to promote instead of the different flavors of money that we're using to get there. So those are some great policy examples. Of course, we're coming up on a transition. Folks may have noticed that there is an election going on, or upcoming. And so that naturally raises the question of, well, what next? Is this going to stick around? Is anything really going to change? And the answer is that federal agencies have been super thoughtful there is a White House-led task force for community solutions to really think about two things. One, how we can deliver on existing policy initiatives. And number two, how we can really institutionalize this as a way of doing business. And not just thinking about the specific initiatives that are underway, but really thinking, how can we make it so that you don't need a special initiative for the federal government to be a good partner for you? That's just how it works. So what this is really coming down to is two areas of focus. The first is people, which is very straightforward, makes a lot of sense. Right now we have a federal workforce that traditionally has been trained to think about their specific programs and following specific rules and requirements. So based on a lot of collective conversation and work, I'll give a quick shout out to the Department of Education and the Forum for Youth Investment. They actually have a report coming out next week called Transforming Governments, Transforming Communities. There's been a lot of thinking about how to train frontline staff. So one of the things that we're doing is instituting a new training. It starts in May for all of the folks who actually work on the ground in communities so that they understand better how to navigate a local landscape, how to navigate a federal landscape, and how to be focused on partnering for outcomes. There's also, for our federal management corps, which is called the Senior Executive Service, a lot of encouragement for people to embed in local communities as a professional development opportunity, so that that's not seen as something that is outlandish or kind of makes you step off of your career track, but it's really embraced as a way to develop people. The second thing is really structures. So this task force has also gotten 16 different federal agencies to sign a memorandum of agreement, which sounds very wonky and bureaucratic, and who cares? But what that does is it creates a framework that says all of these federal agencies agree that working together to support community-based outcomes is a good thing, and they're willing to put their resources together to do it. So what that means in practice is if you have a community that's facing an acute need or situation, instead of having to wait 6 months for different attorneys at different agencies to agree it's a good thing to help them out and move forward, you actually already have that framework in place. So we're setting ourselves up to be much more responsive. So we're really thinking about that combination of particular policy initiatives that expand what we're able to do, but also that basic ability to have people and structures in place to make sure that the work really gets carried out in an appropriate, a collaborative, and an outcomes-focused way.
Terrific. Please welcome Mayor Stephanie Rawlings-Blake. Mayor, how are you? I introduced you earlier, so I was just going to join right in. I let the mayor know I already introduced her, and for many folks in this room, she needs no introduction. Madam Mayor, we're going to let you catch your breath for a minute.
It's my ear that I need, not my breath. I'm feeling a little Janet Jackson this morning. Gotta get used to it.
It could be worse.
Mic.
Looks all right. Looks good.
Thank you.
Arlene and Mary Ellen just gave some opening comments. I'm going to ask them a question, then we'll come back to you, so you have just a moment to kind of settle in. So both of you, and obviously all three of you, but both of you have years of experience working in government and outside government on these issues. If you can imagine yourself as a coach to a collective impact effort, and you were trying to lift up, here's some real opportunities over the horizon. This is the next place you ought to be moving, or some challenges you ought to be looking out for. What would they be? Arlene, why don't we start with you?
Well, I think in terms of looking forward, the first place to start is to look at your data and see where your trends are taking you to try to get out in front of a problem. And then in terms of the challenges of the collective working together, I think one of the things that you talked about trying to institutionalize the work is probably the hardest thing and the thing that you have to pay a lot of attention to, because it can slip very easily back into silos. And there are lots of pressures against the kind of collective work that we're talking about, because it takes extra effort. So there are two things that I think you want to be doing. One is looking at the problems that you have facing you, which allows people to start to focus and sort of naturally pushes them towards the collective work, but then also paying attention to how do you institutionalize it, how do you create structures where there's accountability and people are being held accountable for those collective efforts. And so I think, with the structure, having a legislative body sort of holding the Children's Cabinet accountable is one way to do that, but there are many others. We also have, underneath the Children's Cabinet, the deputies, the chiefs of staff that work collectively on driving policies through the agencies. So there's a level of accountability there for each of the agencies, for the deputies to be reporting back up about their efforts. So trying to find ways to build in sort of institutionalizing it is probably the most important thing.
Good. I'm going to invite the mayor to make her opening comments, and then Mary Ellen come back, and then come back again to you, Madam Mayor, with this question of how you would coach folks going forward. But let me give you a chance to make your opening comments.
I'll say, if you don't mind, I'll just piggyback
Sure.
off of that, because it is with that intention to break down silos that I created the Children's Cabinet in my administration. I often say I'm a bit of an oddball in my family. Everyone is math and science but me, but in the sense that as an elected official, I've always been driven by data. I feel like I fit in. My dad was a mathematician, my mom's a physician, and I've always been driven by making sure that we are effective and efficient, and we can only do that by looking at where we're spending our resources. So I created the Children's Cabinet with all of the agencies that touch the lives of children in the city, as well as our external partners. And that has helped us to align our resources, to prioritize our resources, as well as look for ways that we can collaborate across agencies. So I absolutely agree that for me, that has been the best way to ensure that we're breaking down silos, we're thinking about the entire child, not an agency budget. And how can we work to support, support the children and the families in our city? And I've been very pleased we've been able to increase the spending for youth year over year, even in tough times. You remember when I took office, we had the previous administration had left us with a $140 million budget deficit, and it's not like you can stop focusing on building up families. You just have to figure out a way to prioritize those resources differently. So that's why I was very pleased. I had a team that had the capacity to break down those silos and find different ways to work together.
Terrific. Thanks. Mary Ellen, how would you coach folks going forward?
So I would really underscore and reiterate what folks are saying. I think that moving towards identifying specific outcomes that reflect very integrated approaches and goals across different policy areas really is key, and making sure that people have available and know how to use the data to march to those specific outcomes. And then marshaling resources around those goals that you have, whether it's for youth and families or economic development, or it applies across a range of areas, but not thinking about what are the funds available and how do we sort of stay within our correct lane within that, but really using data, articulating what it is that you're trying to get to, and thinking about a different model of accountability.
So let me sort of build on those comments to reflect on the obvious. We're in the midst of an election year, both in the city and at the federal level. Arlene, you've been through transitions multiple times with government. I'm going to, again, start with you. But I'd be interested in everybody's reflection, again, if you're providing advice. How do you institutionalize and sustain the work that you all have been doing across administrative cycles? It's a fact of life. That's how our government works, and we need to adjust to it. How do you think about sustaining the work as you move to a new administration?
So I think over the years in Maryland, when we've had our greatest success of having the collective work transition with changes in administration, it's been as a result of outside demand for it. And when we've lost ground, it's because that demand wasn't as vocal or as visible. And I think that has to happen. So I think people in the state, in the city, across the nation, if there's a vocal effort to say this is important to us and we don't want to lose this, it then I think loses the imprimatur of a particular leader and becomes something that can be embraced by new leadership.
Terrific. Madam Mayor?
So I would think the key thing in creating the Children's Cabinet that I think will be helpful in making it sustainable is it's not just city agencies. We have outside partners as well. And I say that because everyone knows with the change of administration, all of the at-will are at will, right? That things could change. But because we have those outside partners that have become, I don't want to say dependent, but supportive of the collaboration, I think we have a better chance of it being sustainable, and we've seen good results. My hope is that the broader community will, just as it on the state level, on the local level, embrace the fact that we can't go back to old ways of doing business. Silos are wasteful, and they do not help us in lean times ensure that we are doing the best that we can for the families that we serve.
And Mary Ellen, it's incredibly complicated at the federal level given both the sheer size and complexity of the federal government. But what are some of the things that OMB is thinking about as a transition looms?
Sure. So I think part of it is that it's very easy to get skittish around a transition. And sometimes people want to kind of pull back and wait and see what's going to happen. And I think it's very important to trust the infrastructure that we've built in. A lot of things take a tremendous amount of political will and energy and creativity to get started, like a lot of the work that this administration has done, the initiatives we've talked about. But once those wheels are in motion and you have career staff, agencies, institutions that aren't going anywhere, bought in and attuned to a different way of working together, I think you also have to trust that and keep moving forward and think about how to articulate the story of what's happening, whether it's through data and results, through stakeholder buy-in, so that there's enough momentum and enough motivation for new folks who come in to see space for themselves to adopt that. There may be some rebranding or various things that happen, but to really make that their own without dismantling or taking apart anything that's already happened. Just to give a quick example, as some of you know, we have 9 of these P3 performance partnership pilots that are working in specific communities, and they operate on a 5-year time horizon. So we have communities that have said, we're going to rally together these resources in a new way. We're going to get dramatic flexibility from Health and Human Services, education, labor, all these different agencies, and we're going to institute this new way of doing business. And at the same time that we're having transitions, they may be having transitions. But once you've started all of those things in motion and you've started to change the way that these systems operate on a very granular level, just trusting in that, keeping moving forward and continuing to tell the good story does so much to create an opportunity for people to come in and buy in.
I had one other thing I wanted to add when you talk about making these changes and making sure that they're sustainable and systemic. One of the issues that I saw in my years on the city council, when we talk about being inefficient with resources and not tracking the data, is that previous administrations didn't really know how many of the city's general fund dollars are going to this neighborhood. And for what? And what are we getting for it? And I pushed very hard for that accountability. This is a political environment, and a lot of the decisions around programming for kids and out of school time were politically driven and not data driven, not accountability driven. And I really pushed for a outside of government, not for profit, to be the, we granted the money to this outside agency and said, this is what we want. We want programs that work for our families. We want accountability. We want to be able to track performance. We want to be able to track where these programs are. And through that partnership with the Family League, we've been able to take the politics out of the out-of-school time funding and really push for accountability. I think that's another way to ensure that it outlives any administration when you do something like that.
So I'm going to shift a bit and give each of you an opportunity to say what you'd like from the other level of government. And Madam Mayor, I'm going to start with you and ask you to say, what would you like to see differently from the state in terms of flexibility and from the federal government in terms of flexibility? Arlene, what you'd like to see from the federal government in terms of flexibility and from the city government in terms of partnership. And Mary Ellen, you'll get the last word, which is what would you like to see different from city government and from state government? And let's be clear, I'm talking about generic city and state governments and not specific to state of Maryland or the city of Baltimore. But Madam Mayor, if we could start with you, what would you like from your partners?
I'll start with the federal government and just say at the federal level, I've been very blessed to have a good relationship with this administration, and where there are policies and practices that we believe don't do the best to serve our constituents in the real world. We've been able to work with the federal government and our partners and create pilots and different initiatives so we could test those theories. Is there a better way to do things? So for example, one of the policies around free lunch during the summer was that you couldn't have a site that served breakfast, lunch, and dinner in one site. You could do breakfast and lunch in one site, dinner somewhere else, or lunch and dinner and breakfast somewhere else, and it just didn't make sense for our environment to have to break that up. We knew that families needed some continuity, and children needed to, not sort of, okay, well, I'm going to have breakfast and lunch here, and then I'll go across the street, because literally it could be next door. It just couldn't be in the same building. But we were able to work with the administration and come up with a pilot where we could test that theory. And what happened, we've been able to increase every single year how many free meals that we're able to give, which is significant because we know that too many of our families are dependent on schools during meals from school, free meals from school during the school year, and in the summer they suffer. So I've made it a point in my administration to build the number of meals that we're able to give every single year, and because of that collaborative relationship, we've been able to get that done. And we also did some interesting collaborations around SNAP benefits, where we've been able to break down the food deserts through our virtual supermarket, because we know there's some communities where supermarkets will not be for years, but because we had, and this is across the board, state and federal government, because we've had to work with both on the food stamp issue, we were able to find these partners, Department of Social Services, the libraries, that served as delivery points for groceries, and people could pay with their EBT card. Well, you can't use an EBT card if you are going online for like Peapod or whatever the supermarkets are. But because we created this innovative partnership, you're allowed to have that same benefit that everyone else, in the city has. It doesn't live in a food desert, which is odd to me. To me, you would think that people that live in food desert would need that, service the most. But we bridged that gap, and it was because of our ability to collaborate. So I would just say that what I would need is more of what we're doing, and to be open and receptive to doing things differently. And I can say in Baltimore, we're very blessed to have partners that are willing to think about doing things differently.
Terrific. Arlene, your turn.
Sure. So I think I want to echo that, but from my perspective. So I think hearing from our local partners about the barriers is helpful to us. And so wanting to hear more about what are the problems, what are the policy barriers, what are the challenges that we're creating that we can actually ourselves address, because there's a lot that we can manipulate in order to give more flexibility. And so being able to hear that from the local jurisdictions, the cities, to tell us exactly what it is that the state is putting into place that's creating challenges and barriers on the local level. And then on the federal level, P3 is fabulous. I'd like us to think more about all the agencies that have a role in the lives of kids and families. And I think one that we leave out too often is housing. And what is the flexibility that we can build into some of our public housing policies that would allow us to support some of the youth that we're focused on? So the two areas that we are prioritizing in this administration are young people who are not working or not going to school. A lot of them are homeless. And so what are the challenges that we could be thinking about that people are facing around housing that more flexibility would help us address?
Terrific. And Mary Ellen.
So I think we've solved one problem right here, because HUD is now actually involved in P3.
Yay!
Thinking more broadly. So what the federal government is really good at doing is creating frameworks and general opportunities. What we really need are great ideas for how to have new models of service delivery, new programming that really gets the best results on the ground, and that we could then lift up as examples or scale. And Mayor, I love that you used the examples of summer meals and summer EBT. It's the perfect example. There are these terrific pilots in Baltimore, and now we've seen something that works, and actually the administration has proposed in its FY17 budget to scale up those programs and make them just regular practice. That's not the kind of thing the federal government can just do on its own, because we don't really know what works until there are communities that have these innovative ideas, that are willing to step up, willing to say we've been super thoughtful and creative about constructing how this program should work and bringing partners together, and we just need the federal government to create an enabling environment for us. So that's the kind of thing that we're really able to offer, but we need the innovation and the understanding of nuance and detail and data on the ground in order to really turn that into something fruitful.
Great. So I have one more question, and then I'm going to give you each a chance to kind of close out with things that I didn't ask that you really especially wanted to say. But the question before that is, we've talked about partnership among different layers and levels of government. I think lots of folks in the audience would be interested in what, from inside government, you want from partners outside government. What would you ask from business, from nonprofits, from philanthropy, the faith sector, communities? What are some of the things that you wish you had more of? And whoever wants to lead off is fine.
I'll say that there are very clear gaps in service delivery, and any way that we can get our interested stakeholders, whether it's the not-for-profits, the business community, the faith community, to be in the room and at the table when we're talking about these gaps. They don't have to be, and this is the same thing when I was pushing for this accountability and tracking with how we're spending our money. A lot of the businesses are doing volunteer work, not-for-profits are doing their work in the community. The faith community has circles of influence around their entities, but if we're not talking, they don't know where the gaps are. So they could, move a service delivery a matter of blocks and create an incredible benefit to a community, not take away, because in some cases they don't know necessarily where the need is. They just know where they're located, right? But if we're at the table and talking about, listen, this is a service delivery gap, they can be a part of the conversation and a part of the solution. So I think more collaboration is key.
Thanks. Arlene?
Sure. So having just gone through the budget process in the legislature, I think one of the things that I would love to be able to do more of is work with the provider community around how to work more creatively. We tend to go through a process of demand for specific dollars for specific programs, as opposed to what is it that we need and how can we be doing that with the dollars that we have. Doesn't mean the provider community has to be different, but they might need to work differently, and that's a very hard conversation to have sometimes. So I would welcome partnerships with the provider community to be able to have a different way of identifying resources that can be brought to bear if they're willing to do work a little differently, or in a different location, as the mayor says.
Terrific. Mary Ellen?
Yeah, I would also say just input and collaboration to understand what needs are that will not just be met through federal policy, and to understand which roles are best for which groups to take on in filling those gaps. I'd offer up My Brother's Keeper, I think, is a really outstanding example of having the federal government lay out an initiative, and then philanthropy and other sectors come together in such a powerful way, such as through the Executive Alliance, to really help provide funding, lift up what works, make sure that communities in specific places on the ground have the resources that they need. So it just takes that kind of communication and coordination to make sure that there really is a holistic approach.
Terrific. Well, I'm going to start with you, Mary Ellen, and then Arlene, and then ask the mayor to finish off. Just any things that you'd like to add as closing remarks?
Sure. So I hope that people hear in some of this today an invitation. The federal government is trying to be supportive of good ideas that people have. I would be remiss if I did not say that there will be a new solicitation coming out for a new round of P3 pilots soon. So that's a great way, a very specific way, to put forward your ideas for improving education, employment, and other outcomes for opportunity youth in particular, looking across myriad agencies and thinking about the different resources that are already available to you. But that is just one example. So in general, I would encourage people to reach out to their federal contacts if you have a new model that you think is really fruitful and data-driven in your community that doesn't quite have the right support, that's running up against some federal barriers, and give us the opportunity to do some problem solving with you and think about where we can go together. Again, we've been working very hard to set up the right sort of environment and structures and framework to be able to do that, but we do need people to come to us with their ideas and their sense of what isn't working for them in order to be able to follow through on that.
Thanks. Arlene?
So the one thing that I wanted to be able to note for people is it's not about creating new coordinating bodies necessarily. Sometimes we have too many, and the goal is really to either connect them or to streamline them. And so I don't want to leave the impression that we should just layer on more coordinating bodies, but rather look at the structure that you have in place and to see how you can maximize that to be able to get to alignment of policies from the federal, state, and local levels.
That's terrific. Madam Mayor.
So there's so much in this area, in this realm that is so important to me, from birth, straight through, and how we as a community can work together. I was looking at the name of the conference, Changing the Odds, and I'm thinking we need to stack the deck for our young people. And I recall a conversation I had at one of our local community schools, and as the different partners in this community school went around the table, it was very clear that they were stacking the deck for families. They had identified there were job readiness issues. So there was a group that said, okay, we're going to stand in this gap. There were families without clothing. There was a church group that was standing in that gap. There was the food issues. There was another group there, and literally they were, every organization in the broader community said, okay, these are the problems, and we're going to stand in that gap to work collaboratively to get there. And government has its role. We've expanded mental health treatment in our schools because I understand the issue and the stigma associated with mental health and how that is hurting many of the families' ability to keep their children in school. So we've been expanding that as well as health services. We're working with our partners to make sure that we're helping families that are dealing with asthma and things like that. So everyone has a part to encircle our families with support. And my hope is that the conversations today will spark in people from whatever community you're from to think about how you can create those circles in your community. Those resources are out there. We just have to put them in the right circles to ensure that we are giving the right support to families.
Well, that's a terrific place to end. These are three incredibly busy folks with huge jobs and obviously great insights into what we need. Please join me in thanking them for sharing their thoughts with us.
Oh, thank you.